My wife was denied treatment. The doctor stammered, "Medical director, I had no idea she was your wife." Dr. Gregory Vance's face went from dismissive confidence to ash-white terror in the time it took my heart to skip one beat. He was standing in the doorway of examination room 4 at Metropolitan General Hospital at 11:43 p.m. on a Saturday, still wearing the condescending smirk he'd had when he told my wife 15 minutes earlier that her pain was probably just anxiety and she should try relaxing at home with some chamomile tea. I wasn't wearing my hospital ID. I'd come straight from our house in jeans and a sweater, holding Claire's hand as she doubled over in agony, her face gray and slicked with sweat. The triage nurse had seen us, taken Claire's vitals, noted her elevated heart rate and blood pressure, and sent us to wait. We'd waited for 43 minutes while Claire's pain got worse, while she gripped my hand so hard I lost feeling in my fingers, while she tried not to scream because she didn't want to be dramatic. Then Dr. Vance had walked in, glanced at her chart for maybe 10 seconds, and made his diagnosis without examining her, without running tests, without doing anything except look at my 34-year-old wife and decide she was wasting his time. Now he stood frozen in the doorway, staring at me with dawning recognition and horror because he'd just realized that the woman he'd dismissed was married to Dr. Michael Reeves, medical director of Metropolitan General Hospital, the person who oversaw every department, including his, the person who had final say on physician performance reviews, credentialing, and disciplinary actions. I'd been medical director at Metropolitan General for 3 years, overseeing a 650-bed teaching hospital with 18 specialized departments and a medical staff of over 400 physicians. I was 41, had spent 15 years in emergency medicine before transitioning into hospital administration, built my reputation on patient safety, quality improvement, and zero tolerance for substandard care. My wife, Claire, was a high school art teacher, creative and empathetic. We'd been married for 8 years, together for 12, and she was the center of my world. She'd been experiencing abdominal pain, off and on, for 3 weeks, the kind that came in waves and left her breathless. She'd seen her primary care physician twice, been told it was probably gastritis or stress, been given antacids and told to avoid spicy foods. The pain had gotten worse over the past 2 days, sharper and more constant, radiating to her back. Tonight it had become unbearable, stabbing pain that made her cry out, that sent her to her knees in our kitchen. While I called 911, the ambulance had taken too long, so I'd driven her myself to Metropolitan General's emergency department, the hospital where I worked, where I knew every protocol and every standard of care, where I trusted my colleagues to treat patients with the urgency and respect they deserved. Dr. Gregory Vance was a 46-year-old emergency medicine physician who'd been on staff for 11 years. I knew him mostly through quality metrics and department meetings, competent on paper, average performance reviews, no major disciplinary issues until tonight when he'd walked into that examination room, looked at my wife with undisguised impatience, and asked her what she really wanted from this visit. Claire had tried to explain the pain, the 3 weeks of worsening symptoms, the fact that her primary care physician's treatment wasn't helping. Vance had interrupted her twice, asking if she'd tried the antacids, if she'd considered that maybe she was stressed about something. His tone was patronizing, dismissive, like he was talking to a child who'd invented an ailment to get attention. I'd felt my jaw tighten, but stayed quiet because I was trying to let Claire speak for herself, trying not to use my position to influence her care. Then Vance had said the thing that made my blood turn to ice. "Mrs. Reeves, I see dozens of young women every week with abdominal pain. 9 times out of 10, it's anxiety, stress, or period cramps. Your vitals are fine. You don't have a fever. I think what you need is to go home, take some deep breaths. The ER isn't the place for chronic complaints." He was sending her home without examination, without imaging, without blood work, based on nothing except his assumption that young women with abdominal pain were hysterical or attention-seeking. That's when I'd stood up and said his name, just said it quietly. Dr. Vance. He'd looked at me for the first time, really looked, and I'd watched recognition dawn across his face in stages. First, just a vague sense that he knew me, then confusion about why I looked familiar, then the horrible, stomach-dropping realization of exactly who I was. "Medical director," he'd stammered. I had no idea she was your wife." Not an apology, not a reassessment of his diagnosis, just shock that he'd dismissed the medical director's wife as if Claire's symptoms only mattered because of who she was married to. And that's when I realized what I had to do. Full story is linked below or on my channel.